It is unprecedented from the experience that I've had in healthcare planning for the last 32 years. So it started with the clinical, well, it started with Dave Cook's committee in 2012, where basically it was asking the community, you know, what do you think the vision should be? And the conclusion was that there should be one facility, or one consolidated acute care facility. So that was the starting point. Then, when we started with the steering committee, the Program and Services Steering Committee, it's comprised of the LHIN representatives, the two hospital, actually Windsor Regional, Hotel Dieu, and Leamington hospital representatives, city and county representatives, medical staff representative, and CCAC. And I think I'm missing one, but that's unbelievable. Like the only other steering committees would be solely hospital, and it would not be community-oriented type committees. Then when we met with every program group, like surgery, medicine, mental health, there was representatives from all of, you know, from the hospitals, from CCAC, where appropriate CHC, and together we looked at what were the needs of the residents, what's the future vision for how services will be delivered in Windsor and to serve the region. So there were hundreds of people that participated in that. Then when we presented the work, it was to the hospital staff, to the medical staff, to the boards, including the LHIN board. And I know that David Rouget, David Cook have been out, you know, on the radio. Allison has been out on, you know, doing all sorts of unbelievable web items and helping to inform the community of what a new hospital would look like. And then there's the site selection piece. So in no community that I know of, anywhere in Canada, has there been such an extensive process. From the people who were on the site selection committee and how those people were chosen, to the development of the criteria and how many criteria there were, to the input from the community on what the criteria should be. And in other communities, it's basically somebody offers a site, and you know, and that's where the hospital is going, with no real input around was that the right hospital site, whether there's a conflict of interest because the person's just going to develop this, you know, the space all around to develop other things. So it has been unbelievable. I also have to say that all of this work that's been done over the last couple of years could have been possible if we didn't have a collaborative effort. And the leaders in making this all happen was Kevin Marshall from Windsor Regional and the two LHIN representatives, Ralph Ganter and Sandra Lauderdale. And again, we've never had the LHIN to get, you know, working so closely with us. And the LHIN is, you know, a strong representative of the community and understands what the community's needs are. So it is phenomenal what has occurred in Windsor over the last couple of years. And finally, as it relates to the local share, usually communities don't have their local share until years after the hospital has been planned. The fact this community already has the share commitment has set a precedent that I don't think any other community is going to be able to achieve. So everybody should be patting themselves on the back in terms of how everything has really been.